Okay, I lied.
Just those 4 needles, huh?
Good morning, everyone. 15 gauge needles here today. Let's take a needle here. What's this right here? The tape?
Yeah, maybe.
Where do you want to go?
Above there.
Uh-huh.
Above there. Is it moving?
It's okay. Here's a little bit when we get there, but I'll hold it.
It feels good, Doctor.
Feels amazing.
Dr. Tom.
All right. So what I'm doing here is I'm actually feeling for a 1-inch pathway. My needle is 1 inch long, so I'm visualizing a straight path underneath in his arm where this needle is going to stay in. So Eric has informed me where he would like the needle to go. I agree with that, so I'm going to go ahead and put this needle in. Got this, Reese?
Yep. Mm-hmm.
There you go.
Yeah, that was a tough one, wasn't it?
Yep.
It was a new spot you put in?
A little bit higher than the other one. Right where we want it to go. Now the next one, we're going to go right above this last needle site. And his arm here, when I put the needle in, it rolls. So I'm going to hold it a special way. That's why I want the video on the way we put the needle in to show you guys how to hold the access so that when you stick it, it doesn't move on you. One of my techniques is I'll hold it out like this, give a nice stretch on it. This also helps prevent any pain by occluding the nerves here. So Eric had, originally when I came here, he was using the spray to numb the arm. He's no longer using the spray. We still have it here, but just to let you guys know, we no longer use it because this technique helps prevent the pain.
Technique patent, huh?
We're going to patent this technique, so get it while it's free. Okay, here we go. Like I said, we're going to hold it down tight. And here we go, 1, 2, 3. Here it is. Eric, you okay?
Fine.
Excellent.
Oh, awesome, awesome. I'm sorry, awesome.
A lot of things we work on too is having the mindset right. You know, I want everything that I deliver to Eric to be a positive energy, a positive flow, so his treatments are better. The outcome's going to be better when he visualizes the outcome of his treatments every day. Seeing his care partner coming in with a great attitude. building a remarkable relationship. And of course, we do this to check the placement of the needle as well. Just pull back on it, push in. There's no pain, there's no swelling, there's no resistance on my end. I'm not feeling any resistance. We go through, just do a quick visual of my clamps. The other day when I came here, a clamp was, as you know, sometimes these clamps can get pushed out on the edge like this. When I came here last time, it was out on the edge, so we double check everything. Never hurts having an extra set of eyes. We have no labs today. Sometimes when I screw this on, I get a little residual of blood there on the edge. See it about to drip. So I just go ahead and capture that so we don't make a mess. I'll go ahead and I'll move these lines up in a minute. You know, it just creates that little blood there because we're at the edge of the syringe. I'm sorry, of the tubing. Hold that. When I clamp these, I always make sure it has a little spot here, right? Give him some room here. And if this line ever got tugged, it's going to warn him with these clamps, right? And also gives him that flexibility that he needs over here. Go ahead and start his treatment. Start the pure flow. Sometimes I would tape to the arm, but I don't think I'm going to use this piece today. Looks pretty secure where we're at. So as this starts, we're going to end up, Eric's going to look at the numbers, crossing over, make sure everything's within limits for him.
Starting what? A 2-1?
20.
Yeah. Just clear it and press go, and let's go up to 3.
Go to what, 3?
Yeah.
Another day of good sticks. So as the numbers start going up, you see they'll start to settle in.
It's good. It's good 4.
I'll go up to 400. Yeah, this is a little bit different of a next stage. This is the newer one. It's all digital touchpad. Not sure what you might have there at home or if you've seen this model before.
It's good.
Numbers look excellent.
Excellent. It's good.
All right. So just like in the center, I'm going to take a listen to Eric. Check for any swelling.
Yeah, but off is it?
We're live. I don't know what happened. That Instagram. I'm not sure why we dropped off on Instagram. Apologize. Let's go ahead and get the blood pressure stuff over. All the numbers look good?
Yes, sir.
Great.
Well, awesome, awesome.
So here I'm checking for swelling. Whenever you check for swelling, you always want to make sure you press against a bony area. Don't go in on the muscle. Go in over the bone and press in. Rub your finger over there. See if it has an indent. Everything looks great there.
No swelling, doctor?
No swelling.
Sound good?
Nice deep breath. Whenever your nurse is listening to you, you always want to make sure you let the patient breathe in and breathe out to get the full sound
Of what, the lungs, right?
of your lungs. That's right. I've seen some nurses, they just listen to the inhale, but not the exhale. That's not right. Every time they take the glove off, they should hand sanitize.
It's like a Philadelphia number.
So I'm just trying to see if we can get pulled up here on Instagram real quick. All right. Go ahead and set this up. Looks like we're live on Instagram as well.
It's working now?
Yeah, we're working on that. So good morning to everybody. Just getting started with Eric's treatment. We started a little bit early this morning compared to what we normally do. We wanted to do some video today, have some discussion about home dialysis and some of the pros and cons that we have going on, as well as the effects when you're in a relationship, if you have a spouse or a neighbor caring for you. You know, sometimes they need a break. So, you know, you want to have that option to give them a break. And in addition to that, you want to be able to keep that relationship going You know, sometimes things can be stressful here. You're not sure how to put the needle in. Maybe the needle didn't go in on the first try. Those type of things can create a little friction in your relationships. So we just wanted to talk a little bit about that. You know, ask Eric, you know, his experience with it. And I've been in some of the Facebook groups. I've been looking at some of the posting. So I figured this would be a good topic we can have a discussion about. I remember one of the ladies there was mentioning she had a husband that was watching a football game, and her machine was alarming. You know, you really got to pay attention to what's going on when you're on dialysis, and this is why it's important. Even though I'm here with Eric, he actually knows what happens with his treatment as well. So you don't ever want to be vulnerable or have that vulnerability. Make sure you know as well. Eric, what do you think about make sure you know as well, the relationship with spousals? How's that work with you in your situation? Have you experienced that, and compared to what we're doing here now than before, is the relationship been easier, better, worse, or what would you say?
Well, when my wife was doing it, it's very time consuming. You know, she got to do my treatment for 4 hours and then get ready for work. So, you know, her days, like almost working 2 jobs. So, you know, you're right about the spouses need a break.
Yeah, and so, you know, working 2 jobs and then having that pressure of knowing that, you know, you got to come home, take care of the family member, or if it's your husband, wife, son, daughter.
And maybe it's the unknown about, you know, the day of the treatment, you know.
Yeah, in the beginning it's very frightening, scared, a lot of anxiety.
Right.
Both ends. You're kind of feeling like, you know, you went through the weeks of training in the center, but you had, you know, still a high anxiety because you don't know the support is going to be there when you go home.
Well, plus the burden on the family.
That's right. You know, one of the things that I think is great about doing the home dialysis is that I think is if you have a family member or spouse there, you get to spend that time. It can work on a very positive because then you have the bonding moments of being able to go through a challenge, and you get to have the reward of passing through that challenge. So it's almost like when you fear something and then you go through that fear, you increase your belief lid in that situation. So I think that's great on it. But I also know that it can be very challenging on both ends.
Yeah, I think you need a good support center at the family. Make sure
At home.
At home, definitely. I think that's why a lot of people are at center. They don't want to be a burden on their family. So, you know, have a care partner like yourself will probably, you know, alleviate that problem.
Yeah, we hear that a lot with the patients when asked how come they're not going home. A lot of them will say it's the burden. They don't want to feel like a burden on the family member. So that's definitely something that we do hear a lot. We also hear a few other things like, I'm just going to put my Instagram account down there. We hear a few things like, hey, you know, I like to go home, but I don't have somebody to take care of me at home. I live in an apartment. I don't have the space. And, you know, all those things can be resolved because there's companies out there that provide care partners. There's companies out there that can hold on to your supplies for you, that can come to you and dialyze you on a daily basis. So you don't necessarily need that space or that care partner in your house. You just have to know that going home and having home dialysis is a great thing for you, because you're able to have that independence and that freedom. So why don't we, I think it'd be a good
I
transition
think that's
into that.
that's the key word is freedom. You don't feel like you're stuck to this machine. It's all about freedom.
Yeah, is everybody able to hear us okay this time? I think we forgot our mics, but
maybe just speak a little because of the masks out.
the mask.
Yeah. No, keep it on.
Yeah. So just make sure that they're able to hear. I don't want to say stuff that they're not able to hear. It can be frustrating.
Yeah.
So the freedom of home dialysis, the freedom of being able to travel, have your dialysis on your time. So today's a special day because there's a birthday being celebrated, and we wanted to perform the dialysis treatment early, so we spoke about it ahead of time. And today we're here dialyzing a little bit earlier because the birthday celebration, and these are some of the flexibility you get to have.
That's part of the freedom that you have. You can design this treatment around your schedule.
That's right. So, and not having to only have that structure of dialysis at a certain time in your facility, not being able to flex. Sometimes the schedules are full. You're not able to come in early on your treatment, which makes home dialysis even better.
Well, they wouldn't accommodate this birthday in center. Either you go the time that you scheduled to, or you're an hour late.
You're gonna be late. I don't want to say, or sometimes they skip the treatment,
Right.
because they can't get there. They can share the treatment time with you, or you can get it done before everybody wakes up, and we're still here in the house. So those are some great points of why home dialysis is a better way to go.
And you can have your treatment in the AM, late afternoon, or at night.
And you prefer
The AM.
the AM. Not too early, not too late in the morning.
Right. I get done on a nice certain time of the day, so I still got time left over to take care of my situation, bills, and other things.
Right, so, we're done usually about noon, and we're allowed to wrap everything up. Eric, like you said, when he's done his treatment, he's not feeling washed out. This machine, we could talk about that machine, how this machine's a little bit more gentle on you.
Oh, a lot more gentle than center.
Yeah, so it pulls a lot easier on your body. So when the patients, I've been doing dialysis for 28 years. So the machines before, when I jumped in, we had the Baxter 550, 1550, the Code machines. Fresenius had the 2008 H's, and then the K, the K2s, the T's. That's where they're currently at right now. But the whole thing was when the patients transitioned from the 2008 H Fresenius machine to the K's, that machine pulled smoother than the H's, and you can actually, the patients could tell me like, hey, we feel that pump pulling the blood out. Eric has felt the same change from now the T machines, which are great machines, compared to this one, how this one is so much easier on the body. And, because of that, it is gentler on the body. It's less stress on the heart. And, for the clearance, it doesn't do as great of a job as the clearances in the center, but that's why the patients at home will usually have an extra day of dialysis. So if you're normally 3 days, they might ask you to do 4 days.
And even after that fourth day, you still doesn't feel wiped out. So even though you get more dialysis, you still doesn't feel wiped out as you're doing it inside the center.
Yeah, and I think I mentioned last time, we have a patient that does dialysis at night because his job didn't want him to have dialysis and then go to work because the kind of work that he does. They didn't think it would be safe for him to do that, so he was only restricted to dialyze on the off days. So what we were able to do is when he went home, we could dialyze him at night. So now he has a whole rest period from the night dialysis to the next morning when he goes to work. So he was able to increase his income. It was a great win for everybody. And, you know, those are some of the options that you have on doing this.
And that's another part of your freedom of
Getting your freedom.
designing your treatment.
Right, getting the freedom back. And, Teresa, have any questions or anything in there?
No,
Coming up yet?
not yet.
How's our viewers?
Yes, there's 5 viewers. We have Anglia and Joe joining.
Cortez?
Yep.
Excellent. So, you know, so these are some of the things that we're working on now. I just going over here, I'm looking at his shark container. So when this gets full, we're going to take that over to the dialysis center. I know some people have questions about that. You know, this is being live streamed on multiple Facebook channels, Instagram. Some of them are the home dialysis groups, so I apologize if any of this is redundant to you, but we still think that there's a value here that we can bring to the table that not everybody knows. If you were here when we first started, we did the cannulation of Eric's arm, so I gave some tips and tricks there that I've had for, you know, many years of being in dialysis to 28 years. As I said previously, Eric, he had a prescription of the spray for the arm, the lidocaine spray. I asked him just to try one needle with it, one needle without it. We eased into that. He was able to see the difference, which there wasn't much. So we went ahead and was able to push for the second needle. Now he's doing this without any spray. It's going to be better on the skin because the sprays and the cream, they make your skin like a leather. So as the years go by, it really toughens up the skin. It makes it harder to stick. So, you know, that's something that we like to inform the patients with as well. And
if you was in the center, they wouldn't tell you about all that, would they?
well, there's really no time. You know, being in center, we're always busy trying to accomplish all of our tasks, get everything done that they ask us to do. And we don't have this one-on-one time.
And that's the benefits of having home dialysis one-on-one.
So the one-on-one time, educate, build a relationship, you know, have the opportunity, like what we're doing right here, right now, with the live stream, there's no way we can do this in the center. We would violate so many HIPAA rules. The facility doesn't let us even bring in the cameras. So this is another advantage to help promote kidney failure awareness and kidney exchange. That's one of our company, Prima Healthcare Services' mission, is to get the word out there, get the celebrities involved to help promote this. We find that unless you're on dialysis, most people don't know even what dialysis is. So we want to promote this and get celebrities involved. So Eric, before dialysis, did you happen to know anybody that was on dialysis?
Myself, no.
So you had no idea even what dialysis was? Did
No,
you?
I had to do my own research, get my own information, and there's a lot of stuff out there about dialysis. You just gotta do your homework.
I think being aware that there's something called dialysis and kidney failure needs to spark up the conversations and the awareness of it.
Well,
Because-
the more information that you can get your hands on to, the better outcome is going to be on you.
Yeah.
You have a choice of what treatment that you want for yourself.
Yeah, I agree. I think, but before anybody even is on dialysis, they don't know anything about it,
They don't know nothing.
unless yourself or loved ones on dialysis. So that's where I think the celebrities can help promote this. I know Selena Gomez was transplanted. Maybe she'll see this video. Maybe she can reach out and help get some of this information out there to the world. You know, you see what we do here in the U.S., but there's other countries that we have kidney failure with where they don't have the option of having dialysis, or they have to travel so far to get their dialysis done, or they're paying cash for their dialysis treatment. They don't have a government system like us that's paying for dialysis. You know, this is the universal health care for one organ, but you know, this is what's been around for a while. And your kidneys are pretty much paid for your treatments. Now, there's also been some news lately about the portable dialysis device. Not sure if you've seen it. They're creating something.
You're talking about the artificial kidney?
The artificial
Yeah.
kidney. So that was pretty interesting to see this week. There's some articles on that. It's a lot better than I think we saw the harness belt.
Right.
Looks too bulky.
Oh, that was the wearable.
The wearable one.
Yeah.
This new one, it's they implant it. Looks like they're tying one into an artery and vein, and then they're putting another line in through your ureter.
And I think that's a little smaller than a Coke can, if I believe.
Yeah, that's the one. They're making it smaller. It has a little mini reactor inside. It's run off the blood flow. So that's interesting. We'll see where that comes out.
And you get that, you don't got to worry about no anti-rejection medicines.
Yeah.
That's one of the beneficial of having that.
Yes, saves a lot of money on having to have any anti-rejection. It can be mass produced, so we don't have to have the waiting list for kidney transplant. And you know, so I think the times are coming right now with the inventions.
Yeah, I think there's so much technology out there. I mean, I think within probably another 10 years, dialysis can go and get blown out of the water.
It's something else that I like to see more of. You know, maybe somebody is out there watching this that's connected with Onset and Tableau. We'd like to have a conversation with them about their dialysis machine in comparison. And, you know, we're out here on the East Coast out in New Jersey. We don't have a whole lot of access to the Outset Tableau machine. I know there's a lot of people in dialysis that want to know more about it.
And that's the recent one that came out.
Yeah, the recent one that came out. You know, them and Satellite is connecting with, I think, CVS. So they're working on a new machine as well.
Is that in production? Do you know?
I believe they have something over in New Jersey. There's like one location that they're using. They're collaborating together, and you know, it'll be very interesting to see how the collaborations come out. That's for sure. And a lot of I'll say this too. A lot of places are doing. We call them TCCs, TCUs. You know, our company, Prima Healthcare Services, we call it TCH. It's a transitional care to the home. That's what we know it as. Transitional care. unit. That's what certain dialysis companies call it. There's a transitional care center. And basically the patients are going from the hospital to these locations, and then they're being evaluated to see if they can go home. So it's nice to see that more of those facilities are opening up so we can get patients home. But we still have a lot of patients that are in the facilities that we gotta help them go from the facility to home. If you're interested in doing that, some of the first steps is you want to let your charge nurse of the facility know that you're interested in doing home dialysis. You need a care partner. That's going to train yourself. That's going to be up to your doctor if you're able to do your dialysis yourself.
Does the hospital help you find a care partner? Do you know?
As of right now, there's nobody out there that's helping with care partners. Even as our company, we kind of promoted ourselves. Being in the industry for so long, we also are a staffing agency, so a lot of our clients come from a word of mouth.
So it's up to the patient to do the research and
finding companies.
Right.
So, you know, there's not a lot of inside the centers. There's not a big push of it because there's got to be a home hemodialysis nurse that's got to train you. They got to train the care partner. Then they got to order a bunch of supplies and chairs. They almost come at you like as if it's a burden to do.
So obviously the hospitals don't have the time to.
They don't have the time to teach you and to transition everybody. So it's a small drip. It's a small trickle of patients leaving the facilities. So, you know, we got to find a way to improve that. I know a way is just to constantly stay on them. You know, just be like water, keep dripping on them, and get through that rock.
I wonder if the hospital even mentioned anything about home therapy. Do you know?
So, my understanding is the staff are usually really busy in the hospital, and we even question, you know, when you sign your consent for dialysis, is the patient in the right mind because there's so much toxins that built up in the body. So it's a valid question to ask: is are we really doing the right thing, getting the consents at that time?
So you're talking about when
you're in the hospital,
when the patient
first goes on dialysis.
Okay.
So we need to, I think, really come back and constantly reevaluate and bring that subject up. But as far as when you first start dialysis, I know the staff in the hospital are really busy compared to even the chronic centers, because, you know, they're dealing with very sick patients at that time. Where in the center, everybody's kind of like the same stable, but we're just busy doing tasks. So both sides are busy, but I think the center should really be the one that promotes it the most. If we can get anybody, maybe like a liaison inside the hospital, just communicating to new patients, that might be a great concept.
And you also mentioned to me, last time we talked, is you can basically pick your own kidney doctor, whoever you want to go to, and the center you want to go to.
That's right. So you have a choice of whatever kidney doctor you want, even though you're in the hospital, and just because you're at that hospital, the way it works is the kidney doctors have practicing rights in that hospital. So let's say there's 5 kidney doctors that go to the hospital. So if you end up in that same hospital, one of them is just going to be assigned to you. But you have the right to pick and choose whatever kidney doctor you want, even if it's not these 5, but maybe somebody else in the community. And you have the right to go to whatever dialysis unit you want as well. So if you're not happy at where you're dialyzing, you can go to the other location.
That's a big partnership. You have to make sure the doctor and the patient has a click. Because if it's not working for you, your treatment is not going to be good.
Yeah, that's a very good point, Eric. You want to make sure you have a relationship. I mean, you know, that's our company's founded on is relationship as well. So we always build a relationship with every patient, every client that we have. We're always building a relationship. You got to build a relationship with your doctor. You know, they're your, you know, they are an advocate for you, but you have to be your biggest advocate, you got to assign somebody to be your biggest advocate in your family. Even the nurses, they want to advocate for you. A lot of times they're so busy, it's just hard to do in the center.
Right.
You know? But you have a right to go to any dialysis center you want. And the same thing when you travel, you don't have to stick with Fresenius or DaVita or US Renal Care or, you know, all the different companies. You can go to whatever facilities around where you're visiting if you're going to a facility. If you're in a hospital and you go home, as long as there's a space available, you can go to any facility near your home. It doesn't matter if it's a kidney doctor or not. In fact, we have a patient with us who has been friends with the doctor for a long time, who's a kidney doctor, and then that patient went into renal failure. And he chose, even though he's his friend, he chose not to go with him. And he took care of him for all these years with his kidney disease, but he chose not to go with that doctor. He thinks going with a different doctor is a better choice because that doctor is younger, newer knowledge, and they see a better advocacy from him than the friend that he's known for years.
So that patient did his research and
that's right.
The doctor that he wanted.
So he's got his research. He knows what he wants, and he knows the doctor that's going to give it to him.
I think that's the major key of people who getting diagnosed. Do your own research, get more information. Pick and choose the one and whoever you want in center and your doctor to be.
That's right. Does anybody have any questions out there for us? Anyone on our Instagram or Facebook?
No questions, but we do have a couple people saying they're training for home hemo right now, and they just started putting needles in their arm.
Okay, excellent. Any questions about that process, putting the needles in the arm? I know it's scary, it's a little challenging. When we first started this, if you didn't see it when it replays, take a look, because we did a little scene where I explained a little bit how to hold the graft and the fistula so that it doesn't roll. There's some arms where the access, when you put the needle in, it will shift to the side on you. So I was teaching a little bit of a technique on how to hold that there, steady.
Maybe you can go further than that and tell them the difference between the graft and the fistula.
Yeah, so your fistula, a fistula is the best access you want to have. It ties an artery and a vein together, and that develops a little bit longer than a graft. Usually it's about 3 months. And it's developing because it's got a muscle around it. And every time the heart's beating, or if you're doing the squeezing exercises, you're contracting and relaxing, just like if you're lifting weights.
Right.
You know, you're contracting, relaxing, so it's building the veins. So it's easier to stick. While I'm on that subject, I'll mention, because I saw this week in some of the Facebook groups, if you're in the center and you're getting the needles put in your arm, if you're having a hard time getting the needles in, you want to, or having a hard time having even a machine running, you want to lower your arm below your heart so that it keeps the vein dilated, right? It makes it bigger, and also keeps the blood pooling in the arm longer. So that'll help if the machine's ever having a hard time spinning. With the blood flow rate, if you're getting an arterial alarm constantly, or if you feel it, it's like a flutter, like a little vibration in there. That's usually when the needle is up against the wall, or it's sucking on the wall because there's not enough blood flow in there. And you want to just kind of keep that arm down low. Now the other axis is a graft, and there's different kinds of grafts, but basically it's a artificial tubing that they put in your arm. They'll tie one end to an artery, the other end to a vein, and that one you can use sooner. It's usually about 1 month. Once everything heals, you can go ahead and start using that. It's, again, Errol, this is up to your surgeon or your nephrologist. Usually the surgeon will give the okay first, and then your nephrologist approves as well. And then the third way, which is the least favorite, is the catheter. And that's because it's a foreign object going into your heart. And, without being able to shower, because you don't want to get that wet, you don't want bacteria to grow there.
Or swim.
You can't swim. So it restricts a lot of what you can do.
And then that's prone to infections a lot, am I right?
Yeah, prone to infection. So in the catheters, it does have a barrier that's usually further up in the skin. You can't see it like when it's hanging out with the catheter. When it hangs out up high underneath the skin, there's a barrier. That's supposed to adhere to your skin to create a natural buffer. But sometimes, and that's why they suture, they put the stitches there, and then when the stitches come out, that's why it's not falling out, because it's adhered to your skin.
Right.
It creates a buffer. But there's the drawback on it is if you're sleeping and you happen to tug on it, it can break apart in the sense that it's no longer adhered to your skin.
Does patients ever get them replaced in a certain amount of years?
So yeah, you don't really want to have a catheter in very long, because of the fact that it's a high risk for infection. So you really want to make sure if you have that, if you're dialyzing at home, like in the center we use clean technique, but I'll tell you, been doing this for 28 years, we used to do sterile technique, then we went to clean technique, we did another sterile, and then now we're on clean technique again. So they're flip-flopping it depending on how the numbers are looking across the nation on the catheter infection rates. They come out with other devices that they can put on. There's this round disc. Usually the hospitals will do it. It'll be a round disc, or it'll be a gel, a square gel that's on the dressing. Or the round disc, they'll wrap it around the tubing, and that has an antibiotic in it. So it'll help prevent any infection growing there, but they are very pricey. So the dialysis centers are not going to put that there.
Yeah, you have a care partner like yourself, and the patient, when you guys do that, would you guys assist them doing that?
Yeah, so we do the dressing change, just like if you were in the dialysis center, we would do the dressing change. I would do more of a sterile technique versus a clean technique, if possible. But they're not going to give you the supplies for that.
And remember, you're doing it in your own house, so the infection rate is much lower.
It's lower right from the get-go. Yeah, you're in your own germs here at your house, so the probability of picking up other germs isn't that great. I come here, I wear a mask just because I just think it's the right thing to do during these times. We've been vaccinated. Eric's been vaccinated. But you still got to always protect each other. And, you know, if Eric doesn't wear a mask and I do, we're still protecting each other. If we both don't wear a mask, there's a high risk. Because he may not go anywhere, but I go out and I might go out. You know, I have children, so my children could bring something home from school. You know, even if I go out to Starbucks, right? There's a lot of healthcare workers that go in and out of Starbucks because we all like to drink coffee. So that's my plug for Starbucks, by the way. But yeah, so seriously, you know, we just don't know. We don't know at these times, and we want to always stay safe, take the safe practice, safe route.
I'd rather have a nurse cater to my needs than having him taking care of 3 or 4 other patients. I mean, cross-contamination is happening in a second.
Yeah, again, everything we do. Take glove off, you got a hand wash. Make sure you're a technician, you're a nurse if you're in the center, or if you're home and you have a neighbor, a spouse, loved one taking care of you. Make sure they constantly do that. Take the glove off, hand sanitize.
In the center, you guys are stretched out too, am I right?
Yeah, we do that, like that's drilled in us constantly. But there's still people that take the shortcuts. So being an informed patient is going to give you more power and more knowledge so that when you see these things, you can say, hey, you don't have to be rude about it. Just say, hey, can you please use some hand sanitizer?
Right.
You know, or I just saw you take that glove off. Don't forget to hand sanitize. There's nothing wrong with that.
I mean, you guys don't get offended for that.
No, and a lot of it is, it's not what you say, but how you say it, right? So you know, I wouldn't come off as I wouldn't say it really like, oh, you didn't answer, because you know, there's like 4 different types of personalities, and some personalities you can really offend. So, you know, I know it's not about the staff, but it's about the relationship. And again, if you are positive and I'm positive, we're only going to have a much positive treatment at the end of the day.
Absolutely right.
If you're positive and I'm negative, you're going to know this. You're going to feel this. And it can affect you. So just be respectful. You know, and when they're not respectful to you, there's a process for that as well. There, you know, that's called the grievance process. Make sure you know your grievance process of every facility that you're at. They're pretty much standard, but you got to report it. You can't just, you know, let it go, because if it happened to you, it's going to happen to other people as well. So, and that person may need to be corrected. Whether,
and I think that happens a lot in the centers.
Yeah,
Patients hush and who says when you leave, it don't happen to the next patient?
Why do you think that is?
Well, I think it's because of stressful that the nurse is under a tremendous stress for one thing. One thing is the sooner you leave, another patient comes in there. So I think it's all about time consuming and about money, actually.
Come down to the money?
Absolutely.
But what about the? Why is it that you think the staff are, you know, influence? Let me rephrase the question. Why is it that the patients are fearful of saying something?
I think because they don't want to say something wrong to the nurse and get on the bad side of that nurse. Even though, you know, nurses and patients in there are supposed to have like a one-on-one time when they hook you up and taking your vitals, you know.
But as a patient, do you ever have fear like this person may not set my machine right, or or they might hurt me when they put my needles in? Like, do you?
I mean, I myself had, techs in there and nurses that I prefer, and some days that I get texts that I know, they don't know how to stick. I guess, probably insulting the nurse. I mean, if you want to say something to the nurse, maybe that nurse would take that into, not too well.
So what I find that works best is if you have those situations, is you're going to want to ask to speak to the charge nurse and just let them know that you don't want this technician, Mr. Johnny, taking care of you. At least putting the needles in. Can you have somebody else put the needles in? I've had him before. He's tried it. He's not successful. Can you get Sarah to put the needles in instead?
So you can request.
So you can request. This is your lifeline. Right? There's nothing more important to you on your body than your access. So you have to protect it. You have to care for it and be an advocate for it, right?
I think a lot of people in the center don't realize that they can choose what tech or nurse they want.
Yeah, so you have a right? It's one of your rights to have a competent person stick you, somebody who knows how to stick you, because it's your lifeline. If they mess that up, they don't suffer, you do. You have to go and get all the revisions done to your arm. You have to, be the one that doesn't have the dialysis treatment and watch what fluids you're going to eat and drink that day or until this process is done. You're the one that has to go into the hospital to go get a catheter put in. So 100% be an advocate for yourself.
So the bottom line is the nurse don't suffer. You're the one who suffers.
That's right. And those who are quiet are going to suffer more. And we don't want it to be a point where there's an explosion. So you want to keep that communication line open. Let them know what you're thinking. If somebody was sticking, and we know they're really not that great on sticking you, I'd be like, hey, are you sure you want to try this today? Previously it just didn't work out. And they're like, and if they still push, yeah, I want to do this. Okay, can we have Sarah come by here just to watch in case there's an issue? She can jump in right away. I mean, that's a great way of getting, Johnny trained and reoriented on what he should be doing with your arm. Maybe Sarah knows your arm really well. Maybe Sarah has many more years experience. But maybe Johnny's new and he doesn't. So, another way is to have at least that extra set of eyes there that can jump in right away, so there's no pain, there's no damage that's done.
And you worked in the center. Would you take that as an offense if somebody asked for a different nurse or tech?
No, in fact, I would want. So I'm the type where I would say, hey, listen, if I can't stick you, let me watch who can. So next time, maybe you can give me a try. So, again, it's all about that relationship and not what you say, but how you say it. It's about going in with a positive attitude, not on a patient side, but also on the staff side. You have to have a positive mindset, positive attitude. This is, although it's looked at a lot of times as a factory, but this is not a factory. This is your life we're dealing with. It's very serious. And this kind of goes back to the beginning of our conversation and having this stress and pressure on our spouses or our family or neighbors to provide these treatments. It's a very serious thing. We have to show up every day just like you do. We have to be willing to accept any consequences of anything that we did wrong. And, I'm a, I still just get like, mind boggled on having family take care of another family person just because of the mindset of what if they did something wrong, always having that on their conscience.
Yeah, guilt.
The guilt. So I just think that's super huge. I commend the people that do that as a family member or as a neighbor. It's something that always, like a story that I always remember when I say this, and this is why I even bring it up. So we had a nurse who had witnessed, she was babysitting her younger brothers, and one of them ended up in the pool drowned, and she always had that on her conscience. Her parents were at work, she wasn't paying attention. Brother ended up in the pool, ended up drowning and dying. So it's constantly on their mind, and it's just that effect that something like that could be so true with providing care. Something's messed up, you feel guilty about it.
And I think that's one of the fears of your spouse is doing it.
I think it's an unspoken fear.
Yeah.
A lot of people won't talk about it. We make a commitment when we marry, but when they're asked to make that move, I mean, 20 years again, I've seen people go into kidney failure, and I've seen families separate. Some families cannot handle a sick person in their family.
That's why it's good to have a care partner who has great experience in caring for you.
That's right. So, you got to make sure it's the right person for you. Don't push because you don't want it to, put stress on the relationship. So, yeah, it's definitely something that I'll always remember, that pool story. And, I relate it with this because I've seen some articles this week that, some patients were talking about it,
So let's get back to in the center. A lot of people don't know this. If you're a patient and you're my tech or nurse, and I ask you, I want some information on home therapy, and they don't give it to you, or that nurse just passes you by, what's your next step?
So if you're the patient and you're asking for how to go home,
Yes.
or you want some information about home dialysis and you're not getting any information back from them, they're just kind of busy in their day, ask again, ask again, ask again. It doesn't necessarily have to be that individual, but go to the next level up. The next level up. The important thing is, do not give in, do not give up. Be like that water dripping on that wall. It's going to penetrate through sooner or later. You just got to stay persistent with it.
Because me being a patient, I've seen that happen many times.
Yeah, so I don't know the situation, but I'm going to tell you, just in the world that we currently live in, we're distracted. So many advertisements, so many things every day. That's not that people have ADHD, it's that you're constantly being bombarded with other stuff. You can't focus on one thing. So I think the same thing happens. Dialysis can turn into a routine if you allow it. And the routine can be good and bad. It can be great because you know what to expect, but it can be bad because the people turn into autopilot. And so when you're asking a question, they're yesing you because they're busy going to go do something else, and then they're distracted with 10,000 other things throughout the day. I always say, ask at least 3 times. And if you're not getting your way, go to the next level. Who's the charge nurse for the day? In fact, if you have a technician assigned to you and you ask the technician, there's always a nurse that comes through and listens to you, your heart, your lungs, assesses you, gives you medication. Ask that nurse to give you information. And if that nurse doesn't do it, go to the charge nurse. And if the charge nurse doesn't do it, you want to go to the administrator, the clinic manager, to get that information as well. And if none of them give you information, go to your doctor, call your doctor's office up, make a call, tell them you're interested in doing home dialysis, you want to get that process started. Ask them what exactly do you need to do on your end so that you're ready to go, and if he can help facilitate that transition.
And that's your right to pick and choose where you want treatment at.
Absolutely. You can have, it's your right to pick and choose where to dialyze at. It's your right to pick and choose what type of dialysis you want, as long as the doctor approves it.
Right.
Meaning, he says, yes, you're a good candidate. You know, you want to go do PD. There's no surgeries there before. There's nothing that would prevent you from having peritoneal dialysis, right? But if it's if there's a reason, then we have to respect that that's the reason. Now, you can always go get another opinion as well, right? Just like we've heard stories about individuals who are, you know, older and they want to get a kidney transplant, and they've been told they're too old. Well, I've heard stories where they've gone to another center and they said, age does not prevent you. Right? So they'll just do a full body workup and see if there's anything that you need so that you can continue to do the transplant list.
And fall back on if you're a good candidate. If you're not a good candidate and you keep on pushing it, no matter how hard you push it, the doctor ain't going to allow you to go home. Because it's a big responsibility.
Yeah.
You know, you got to be on top. You got to be on top of your treatment.
Yeah, I agree. I think that's true. Although I like to see, you know, those type of people who can't do the dialysis at home themselves. I like to see those people be the ones that also hire a care partner to help them out, so that they can have that option.
Right.
Even though they can't do it themselves, they have the option to hire somebody that can be their care partner.
And that's where the patient has to do their research, find a care partner out there.
That's right. So I did talk to somebody yesterday regarding a patient who wants to go home. There's somebody in the center that they would like to hire privately. But, you know, we're starting to see this transition happening where everybody's going home now. So the issue is the companies are now saying this is a conflict. This is why I just found out last night. It's a conflict of having the company have an employee go and dialyze their patient at home. And I can understand that to a degree, because if something's to happen, it's going to fall back on the major company that he works for. With us, to give an example, everything is third party. You're hiring a third party, not a Fresenius or DaVita employee, somebody who has insurance, somebody who has a workers' comp. You know, if you hired somebody from a dialysis center to come here, they slip and fall going down your stairs, they're coming after you, right? So hiring a company that's insured for workers' comp, has malpractice insurance, those are things you're going to want to look for just to protect yourself as a patient. Experience, 100% experience. So you may like somebody in the center, but think about the other variables in there. It only takes one lawsuit to put you out. And, you know, that's the last thing that anybody needs, you know, when you're dealing with home dialysis. So
especially, you know, you find somebody who has experience in what your treatment is, you know, you feel a lot more comfortable.
Yeah, I mean, listen, there's no doubt you do because you're building that relationship. They know your arm, they know your axis. You want to hire them, right? You would want to hire somebody within your center. But you got to remember the people that you're hiring in there. Anything happens at home, it's just a work for hire job. They're like I said, they slip and fall down your stairs and they're injured. They're going to sue you for their medical bills because there's no workers' comp, there's no insurance protecting that person. So, you know, a good argument would be, well, we hired them from DaVita. We hired them from Fresenius. It was Fresenius' employee. So you want to go after Fresenius if they're, you know what I'm saying? Like, you just got to be careful when you're doing that. You don't want to make sure you vet your care partner and the organization you get them from. You know, do your due diligence on it.
So this is the patient look into every aspect of that.
Taking control, the patient taking control. Sorry about that.
If you don't take control, nobody else, because like you said before, you know, this is your body, this is your treatment.
Are we still on, Facebook?
Just Facebook. The Instagram's not working.
Why is Instagram not working?
I don't know.
Is the other phone there?
Yeah.
Let me see, want me to see one of them? Or are you working on one?
No, I'm working on it. Okay. It's connecting. Okay.
We're live?
Yep.
We're good? Okay. Yeah, so, we're coming to you on Friday again, making this video. Just trying to get some information out there to the public.
And informing people.
Informing people
about this.
We know you might be on dialysis for a while. You might be dialyzing in the center or maybe already at home. But we want to get this out there for those who are not at that position yet, not at that place. So we'll probably do another video next Friday. We'll pick another topic, or if you want to leave some messages on what you'd like to see or hear us talk about, I can go over some more skills of cannulating. If you missed that, I did a little piece in the beginning. We went over a little bit how the nurse should be assessing you to check for fluid, how you can check yourself. Did some discussion about care partners, being spouses and friends, what to look out for, how to have a conversation with your nurses and your technicians when you want something and you're not getting it, and how to transition to home. What about as far as medications, Eric? Are you taking more or less at home for medications?
Oh, less.
Is that part of...
One thing is less for my blood pressure because, as you said, this machine does less damage on your heart. So my blood pressure went down. So less medication I'm taking. Which, it's always less medication you take, your body reacts to that.
Are you cold here? I know a lot of times patients are in the center, they're freezing cold. Were you freezing cold in the center, or were you...
Oh, in the center, yeah.
Both dialyzing at home, you don't have, that's gone away?
I can determine the temperature of my liking.
Got it. How has the environment improved with your mindset?
Doing that at home?
Yeah, doing it at home. Compared to in center.
I myself, the mindset for myself is I know I'm in control of this treatment. I can pick and choose. It's all about freedom, actually. It's all about freedom. I'm not stuck in one center.
Yeah, that's the key words, the freedom. I truly believe home dialysis is giving that back to the patients, giving them the freedom, giving them the ability to take control of their treatment, their care.
And on top of that, a lot of patients in the center don't know nothing about home dialysis. They don't advertise that. You know?
They're not promoting it, they're not pushing it.
Right. So I think that's why, you know, you and I are doing this, getting people informed, get their life back, you know?
Yeah, so a lot of patients are at home. There's we have a patient now that's transitioning to home. It's at least 5 weeks, he's being told, because they got to order the chair. They got to get supplies, a machine, they got to check their water. They sent a plumber out to run some very small tubing. And that takes a little bit of time, but it's just, you got to stay on them with it. You got to get that process going as soon as you can.
Which is it's a good thing about them doing all this tests. They want to make sure the water quality is up to par.
Absolutely, absolutely. Those are all very important things. But it isn't something that happens overnight.
Right.
So these things do take time. So they got to plan for it. But the other big thing is when there's a big push for everybody to go home, there's only 1 or 2 home hemodialysis nurses at the facility. So if you got 5 people that want to go home, that 5 weeks is going to be a lot longer.
Right.
Because now they got to line all these people up. So they're going to get backlogged. You're going to start seeing more and more of a push for
And
home.
plus, you know, you transitioning from in the center to going home. So you know that there's a lot of paperwork over in the center than going home that they have to do.
They have to set up your account for your supplies. They have to set up an account for your machine. Like I said, they set up an account to order a chair for you. We've done a couple of different things here. We got a cart over here. I'll show you in a minute. There will be a lab spinner that we spin your labs in your house. We set that up. All this stuff takes very little space. It's not like before when we had the bigger dialysis machines and we had put a reverse osmosis water treatment system in your house, where we had to run new plumbing and we had to have those blue and red containers, the acid and the bicarb. All that's done. They don't do that anymore. All that you do is you have a machine this size. This takes place of the blue and red acid and bicarb. We have a water line that goes to the machine in the back, and we have a drain line from here. You can actually, with this machine, you can go, as long as you have power, you can go anywhere and have a dialysis treatment, even without water supply. Eric, tell me how that works without the water supply. Let's say we're in the desert right now. And like, hey, Tom, I want to have a dialysis treatment. We're in an RV, but we have no water.
Well,
what are we going to do?
That's one thing about home therapy using the next stage. There's always a secondary for that. You can use hanging bags.
Hanging bags
takes the place of this pure flow here. So if you go on vacation, you don't want to take that bulky thing. You just take this unit and your hanging bags.
Right, just take this one. And they're hanging bags. They're, how many, was it 5? 5 liters?
Yeah.
5 liters per bag. And so what he'll do is he'll use 10 of them.
10 bags.
Because he's on 50 liters. Actually, 60 here, 50 on the hanging bags. So he'll use 10 of those bags. They're 5 liters each. So that's going to be a little bit more supplies you're going to have. But guess what? We can be sitting outside next to his pool having his treatment if he wanted to. He could be in the desert if he wanted to.
And if you go on vacation to a hotel or something, they ship those bags to you.
Yeah, so Eric's just saying, if you're in that vacation mode and you know you're going to go somewhere, you can actually call. Do you know how much notice you have to give?
It's a 72-hour notice.
72 hours?
Yeah.
72-hour notice that you're going to be going to, say Eric's like, hey, I want to go down to Miami. And, you know, all he has to do is call next day to say, hey, I need 2 treatments. So he's going to need 20 bags sent to this hotel. Let the hotel know you got a shipment coming down there. And everything's going to be shipped there via next stage. All Eric's got to do is grab the suitcase for the machine, put that in, take that on the plane, and he's going to be dialyzing in Miami within 72 hours in the hotel.
Plus, even though I'm on vacation, I'm still in control. I don't have to worry about finding a center so many miles from my hotel and going in their time, you know. I mean, on vacation, I want to enjoy myself.
That's right. So he's going to be able to dialyze whenever he wants. When he lands, right? When he lands in Miami, he's going to be able to dialyze. He wants to dialyze that night, he can.
It's all about freedom. It's all about freedom.
Right, getting that freedom back, you know. How many times I hear, oh, I'm on dialysis, I'm stuck to a machine. No, misinformed. Yes, this machine you're going to need dialysis with, but you have the ability to travel. You have the ability to have your freedom.
And I've been on vacations many, many times.
There's no reason to let kidney failure prevent you from living life, traveling, getting on cruise ships, getting in an RV, hitting the road. You can do all that still with dialysis. It's not hard. The more time goes by, the easier everything's getting. You get the process down.
Absolutely right.
You're gonna be able to do this without even blinking an eye. A lot of people, they don't want to do something. Their answer is, no, I'm not going to do it. It's because, you know, one of my mentors, Grant Cardone, he tells me, when you got the word no, just think K-N-O-W, so the N and the O, no, I'm not doing it, is because they're lacking a knowledge, the K, or the W, the wisdom. As soon as you have that knowledge and wisdom together, you can turn that no to a maybe, that no to a yes. So you can have that dialysis, you'll learn the system, you learn the process, and then you're going to get your freedom back. You'll be your own advocate. We just had a conversation the other day. Eric gets admitted to the hospital. Did you know Eric can actually have me come in there and do his dialysis? That's your right. It's written on all the hospital walls. Patient's Bill of Rights. It's his right to have private duty.
And I'd rather have a person who does my treatment and knows my body, knows his sticks and everything at the hospital. I would feel more comfortable that way.
That's right. So when he has his dialysis treatments there, guess who's doing the dialysis treatment? I am. I know Eric. I know his body. I know his treatments. I know his blood pressure runs. I know what day he's feeling the most down, what day he's feeling the most up. Because we built a relationship. We didn't just come here and dialyze him. We didn't just have him show up, sit in a chair, get him on, get him off, and get him out for the next patient. We learn about each other and what makes him work and what doesn't. We educate him. He educates me. We go back and forth. It's a give and take. And we build a really remarkable relationship together.
And remember, that's your right to have your own nurse there assisting you inside the hospital.
That's right. As a private duty, you have a right to hire somebody in a private duty if you're admitted to the hospital. If you have your care partner can still do your dialysis. Read it in the patient's Bill of Rights. It spells it out. You can look it up on the internet. You'll see it there. Patient's Bill of Rights. New Jersey is very clear, written on the Department of Health website.
So what do you do if I contact you and says I need dialysis? What do you do? Do you contact the hospital?
Yeah, so I'm going to let the hospital know that Eric has hired me as their private duty nurse. I'm going to tell them about our relationship already. We do his dialysis, and we'll set it up so that I can go there and do his dialysis for him. Just because you're admitted, especially if it's something else, like let's just say he needs surgery on his ankle or something. So he doesn't need the dialysis from the dialysis unit. He can still have his dialysis in his room. He can still have his dialysis there in the hospital with me as his care partner. So those details would have to be hashed out with the hospital, but it's his right to have that, and it's his right to obtain that and get that through the hospital. So I think that's a piece that people don't know. I think until we had that conversation, you didn't know.
No, I didn't know neither. I had no idea.
So read your Bill of Rights when you're admitted to the hospital, or even before you go there, you can read them and get informed. Goes back to the freedom, right? You want to have your freedom. You want to be informed. You want to have your power. You want to have the ability to advocate for yourself, not depend on somebody else who's busy taking care of 4 other people. Advocate for yourself so you can have the one-on-one experience, dialyzing at home. Make sure you ask your facility, give you information on home dialysis, how to get there, what the process is, what the time frame is. Start out with those questions. When you're dialyzing at home, or when you have a patient that's going to dialyze at home, what is it that you look for in that patient that allows them to be successful? What's a successful patient that dialyzes at home look like? Do you line up with that person? Are you able to make those adjustments to go into a home dialysis program? So these are the things you want to ask yourself. You want to ask the facility, ask the kidney doctor, ask the charge nurse. Get informed. How long did it take you to transition to home?
I think I was the lucky one. That
you did PD, right, first?
I did the exchange first. Then I went to PD, and then I went in center. And I was in center for about 4 months, and they came up to me and said, "I think you'd be a good candidate for home therapy."
Nice.
I didn't know what home therapy was.
So you didn't even know? Nobody even said anything to you?
Nothing.
Wow.
So I did my own research, my own education. I said, I think I can do this. And as soon as I said, let's do it, it took probably 2 months to 3 months. Because, my wife was my care partner then.
Okay.
And
right.
before you even go home, they train you. Train you to do the machine, their pure flow, take care of your labs, your inventory. So when you go home, you 100% know what you're doing.
Confident.
Right. So they don't just send you home with the machine and say, "Oh, there you are."
Still have anxiety.
Oh yeah, of the unknown, of the unknown. But it's all about the.
How was the support though? Did you have a lot of support? I know we have a next stage phone number. What if there is a medical question? who do you normally contact? Who would you contact at that time?
What, during the treatment?
During treatment and or maybe you got a question. Because, you know, when you're in the center, you've seen the staff 3 times a week.
Oh,
so what do you do now if you got a question?
When you decide to go home therapy, you are assigned a nurse. And that is your nurse no matter what. You call, it's 24 hours a day. If you know something's wrong with your body, you can call, just pick up the phone and call her.
So you still have an open line. Matter of fact, it's even more now that you have home dialysis. You have that open line communication.
Right. So you always got a nurse on standby. And when you're in treatment, they give you a 1-800 number to the next stage. If you don't know how to solve an alarm, they'll walk you right through it.
Nice. So the support's there. Just getting over the fear, the anxiety.
Yeah.
And you do that through knowledge and wisdom.
Oh yeah,
Getting informed.
It took me, well, I would say me, my wife and myself, probably 3 or 4 months to really be comfortable. And once you do this machine for about, I don't know, a week, 2 weeks, you find out how less pressure it is on your heart, how much energy you still have on there, and you can do things that you want to.
Yeah. There was something else I read this week, Eric. We want to transition into this. They're talking about the iPad and what happens in the iPad when the information doesn't cross over. What are some tips and tricks that you can give to those who are watching regarding how to fix that if it's not crossing over?
You mean if it's offline?
It's offline.
Well, when you get this machine in your house, you always get a next stage router. That's coming from next stage itself. So if that goes off, you unplug.
Let me pull the camera up and we'll get some video.
Yeah.
Okay, so
Look on
the router.
Take a picture of the router.
Okay, so here's the router here, everyone. So it says next stage on it.
So on this, here, take a picture.
This is kind of like in the back of it, right? So that's the router there.
Take a picture of this too.
Here's the iPad.
So if there was no communication up here, it would say right here, no communication. So I would go to that router, unplug it,
Okay.
wait for 10 seconds, plug it back in.
So the plug button, I'm not going to unplug it obviously, but you'll see this is the power cord right here. Okay, so who would unplug that and you'd wait how long?
10 seconds.
Okay.
You plug it back in. You go on the settings on here. And you wait until that next stage address comes up. Once the address comes up, you go and back of this machine. There's a little weight box over there. It's called the connect box.
Okay.
And there is a soft button you press up there.
So you're going to press the button?
You press the button for 10 seconds. And after you do that, it takes probably 5-6 minutes to that machine communicates to the router and onto here.
Okay.
And if you are out of communication throughout the day, you always do paperwork.
The paper flow sheet.
Right.
So obviously the router is a much easier way to go.
Oh, much easier because whatever alarm goes on there, it goes on here.
Any tips and tricks or any nuggets that you can give on how to use the iPad more efficiently, or anything that you found where you're like, oh, if I do this helps me out?
Yeah, it's pretty much it's self-explanatory.
Okay.
I mean, I really don't put nothing in there besides my blood pressure, my vitals. Everything else is in here already.
Okay, got it. So I guess what I'll just show is, so here's your Wi-Fi stick over here as well. This here will transfer the information into the router, which goes into the iPad. He's got that over here, the router. relatively close. While I'm here, I'll actually show, for those who do not know what the plumbing would look like. So this is the, you'll see a blue line. The blue line's here and the black line. So the blue line is actually the water line. And then that goes into the sink behind the wall. And that will tap into the cold line. It's just a T, it looks like a T adapter. And then the drain line actually goes into the, after the P trap, you know, underneath the sink, the drain underneath the sink. They just tap right into that. It's a nice closed seal system. It looks very professional. That's hired through a local plumber that does that. But it's not hard to do.
That goes through next stage too, so you don't gotta worry about hiring your own plumber.
So you don't have to vet any plumbers. Right. It's done for you. On our wall here too, I'm going to show this little cord here. That's the one that they use for your charging of your iPad. So when we're done, we do plug in the iPad. You know, this is a normal Apple iPad. It just plugs in right on the bottom here, right?
And this is the pre-treatment stuff.
So that's your pre-treatment information you're going to put in.
Right.
Before the treatment, before you can go in.
And this is the treatment that I am in now.
That's what we're monitoring.
My pressure, same pressure zone here is on the machine. Venous, same pressure zone there on the machine. And this is my waist.
Fluid pressure. So you see what he's saying? This is arterial, right? 200. Fluid pressure, that's how much time's left, 2.5 hours. The venous pressure is 197 to 213. So that's the same information that is getting transferred over here.
Right. 2 minutes and 30 seconds. Blood flow rate is 400. 15.7. Ultrafiltration. And this is going to tell you, it's going to have a black screen up there. It's going to remind me when my next blood pressure is.
So it should be going off any minute.
I still got 2.4 liters left to process of waste. And I still got 38.3 water inside my pure flow.
So this right here, you saw that just popped up, that's telling there, hey, you got to check your blood pressure.
So there's no guesswork. It tells you everything that you have to do.
So now all he does is hit the button. I just came across one of these yesterday. I didn't know they even made them. It actually talks to you.
Oh, yeah.
It tells you what your reading is.
Well, you can get those in a Bluetooth, too.
Wow, Bluetooth.
Yeah.
Okay. Interesting. So just to go over those numbers, I'm just going to open the next stage up real quick. So you'll see here 1 liter an hour, which what you just saw on his screen. 15.7 liters per hour. We switch over to the rate screen. It's got 38.1 left and 2.4 fluid removed left as well. Blood flow rate's at 400.
Open the
and this is the pure flow here. So remember, there was like 38 liters left in there, so it's still quite heavy. It's in here. It's, you know, it's a sack that's in there, and
that again, that holds 60 liters of fluid in there.
Oh yeah, Eric just said it'll hold 60 liters. So 60 liters is what he used. He used a full bag during his treatment.
You have a number 1 filtration that's in the bag, and a black thing right here that has 3 filters in it already.
Right here, that's got 3 filters in it. That's the pack.
So the only maintenance you do on this machine is every 6 months you change the pack.
Every 6 months, guys, you're going to change this, right?
And then,
Unless it fails before then.
right. And it will tell you on that screen, open that up, it will tell you on that screen what exactly what's going on. If my pack needs to be changed, it will give me a 72-hour notice.
There you go, 72-hour notice ahead of time. If this pack needs to be changed.
And like I said, next stage provides all this for you.
Next stage will provide that. And we'll even, we'll go over when we change this next time, how to change that. I'll show you how simple it is. There's one hard part. It's this little, I call it like a phone line.
Yes.
And it's just because if you can kind of see, that's on an angle. Believe it or not, it's actually an angle that's in there that makes it challenging to do. Wish they would have come up with a better design.
And if you ever exhaust that 72-hour time limit, it won't allow you to make a batch.
There you go.
So that's
So you can't, you can't.
One of the safety features on there.
You can't. Yeah, you gotta make sure you have that that change before then.
So there ain't no way you can override it or nothing. And once a year, you change the number one filter back there.
It's the number one filter right here. The setup. Some of you were wondering what was that filter there. You see the hole that's in the wall too. It's just a very small hole. That's going to the bathroom sink next door. Again, that's just a T that goes into your cold water line, and a little notch that goes into your drain line. Has there been any problems with that plumbing since they've done it? Any leaks or anything there?
Nah, not at all. No.
Okay.
And one beneficial that I forgot to mention last time is your rinse back mode. You get every ounce of blood back inside your system, so your hemoglobin don't be going down. So that's very, very important. I noticed in center.
Yeah, compared to in center. So here your hemoglobin stays well, within range. Less epigen you're taking, or any ESA medications. That's what nurses would call it, but it's epigen, your Procrit, your Macera. You don't get as much as that anymore, because you get full return of the blood cells. So,
and you can hear the machine really isn't that loud. It's very quiet.
Not loud at all. Let me see here. We're gonna see if we can go live on Instagram as well, guys. We have some followers that want to see us on Instagram. We want to get to them. We keep the sharp container nearby. Again, once that's full, we cap it, put a cap on it. We're going to take it to the dialysis unit. We tape on a little trash bag here. Right there, it's convenient. I rarely use it. I mean, I do, put the trash. We just keep a trash bag here that we, swap out.
You don't need no special bags for waste. Everything goes inside there.
Yeah, no special bags or anything. So, what we'll do is we'll go over some of the supply carts that we have here.
Well, the supplies come once a month. You get supply from Next Stage, and then you get supplies from Metro Medical, which supplies your gloves, your gauze, and your needles.
And do they call you to let you know that they're doing a supply order, or how does that work? Is it automatic?
Next Stage, they give you a 2-hour notice on Next Stage. You can do your inventory on this and press send. The only thing that I contact the nurse for is the Metro Medical, is your gauze and your gloves and all that.
Okay, and how far in advance are you getting your supplies?
As soon as I call my nurse for Metro Medical, I get them in 2 days. Next Stage, they always want your order in by 3 weeks before the delivery date.
So you need to plan out 3 weeks worth of supplies. Then.
Right.
What would happen if you made a mistake on your ordering? How does that get resolved?
What you mean on my part or their part?
Like, let's say they didn't order enough dialyzers, the setups. How many?
Well, you can.
How would you handle that?
If that happens, you have to contact your nurse, and they will call next stage. And the very next day, you would get your order.
Have they ever said, "Hey, we might have a box here at the center, or we might have what you're looking for here at the center. Can you come by and pick it up?" Or they might
using the Pure Flow knob, because each person has their own different prescription.
Okay.
Now, I myself had the wrong order shipped to me. I use my prescription is 402, and 405 got ordered to me. So I had everything the very next day. So there was no waiting time.
So that brings a very important point then. So when you get your supplies, you need to...
Oh, you always got to double check yourself.
Double check your supplies, right?
Absolutely, yes.
Now, I also know that the machine asks for a certain number, so you can't really put it in there if you're reading it the way it asks you to.
If you put a different bag in there, and my machine has 402, and you put 405 on there, it will send you an alarm on that this display panel right there.
So you're going to get an alarm on the display panel here.
And that's one of your safety features also.
Yeah, it's a safety feature. So see, here he's got the 402. It's written on the label here. This is what we're talking about, guys. The 402, SAC 402. So they have a 405. So he at one point got a 405 delivered to him. So thank goodness for being informed.
And all the bags were 405, so not just one of them, all of them.
All of them were. So he had no 402. Got to get a new one.
So that's when I say you got to be a good candidate for home dialysis, you still got to do your make sure you have your own supplies and your own prescription according to you.
Right, and again, that's something that we can also help if anybody's interested with signing up with Primo Healthcare Services. We can help do your supplies, your ordering, your list, double checking deliveries, things of that nature. But let's go into some of the carts real quick, just to kind of give you a quick view of how we have this arrangement set up here, a little bit wider view. So we have the cart right here, right next to Eric. So he's got some things on there that he likes to snack on during treatment if he needs it. He's got his candy there. We have the supply cart. This is any of our recent supplies, necessities that we need right away. Everything's here.
Well, you can call that the refill cart.
The refill cart. All right, there's the Primo timesheet. Casinos, sometimes we come here, we may not have a timesheet on this, so we got one on standby. It's all organized.
So they always give you over their amount, just in case you do run out. You always got a backup right there.
That's a good point. So a little backup. Here's what we're going to do. The treatment sheets are down in here. We got them as well. Just a quick overview of what's in that cart. We have our bleach water right up here as well. Hand sanitizers here. We got the Dialysis Training Center, competent nursing staff, hand sanitizer.
Sanitizer is always a plus.
Right?
And what I forgot to mention before, when you go over there, look on the bottom shelf of that white shelf. There's a blue bag in there. That's if this ever goes out, as in communication, you can always look up your alarms on there. Always
The alarms. On
There's
the book?
two books on there for your next stage and for your pure flow.
All right, so let's go take a look at that real quick. So here you go. We got the lab spinner here. On this shelf here is where we're going to spin the labs. Here's some lab supplies. Here's the ones that helps balance the spinner. Right? We got our trash bags here, and here's the blue bag with the next stage books that are in there. And you know, the way that you do your spinner, I know they're going to teach you, but just to let you know, so this is filled up with a water solution. We call this the dummy. So if you have one of this yellow tube, you're going to put it here, and then you're going to put the other one right directly across from it. Right, and then this one would be the one that had your blood in it, and then you would put, to balance it, the dummy one right across from it. So that's important to make sure that's balanced so that it doesn't explode inside. And then here is the supply room. This is not that big. These are all lab boxes, right? So we have our supply lab boxes. We have our gowns, our saline, needles. All right, so here's our saline. Just a little information. So every saline bag has an expiration date. Make sure you guys are looking at this as well. So this one expires December 21. So we want to make sure this is used before then. But always check your expiration date. Always check the name of the medication on your bag. Make sure it's 0.9% sodium chloride. I worked at a hospital before where they actually brought in the wrong saline. Of course, there's our setup. Here's some soap, disinfectant, things like that there. These are our sacks, the 402s. See, this is sack 402. It's there. All right.
Why don't you take one of them lab boxes out and see actually what comes in there? Small
Yeah.
boxes in there.
So with the lab box, what we'll do here is we'll open this one up. You don't have the one that's open?
No, you can open
Oh, here's one. Here's one. So this is a lab box right here. We'll just come back over this way. So here's your lab box that you have. So this is got the Spectra Lab. It tells you which side's up. You're gonna open it up. It's gonna give you directions on how to pack your lab. Right, so you see there's an ice pack in there. Right, you got ice pack, you got foam, ice pack, foam, and that's exactly what you see in here. So you have the biohazard bag. That's where you're going to put the specimen. This helps soak up anything if there's a spill. That's another plastic bag. Excuse me. This is styrofoam, and here's the pack. Now, obviously, we have a few in the freezer already, but we don't want to fill the freezer up with ice packs. So as we use one, we take one and put it in the freezer.
And your lab for your mail to you. The lab book will tell you exactly what vial.
Yeah, so here's the mailing labels that you have for the labs. So you're just gonna put that on the box. So like I said, when you put this all in, and this is all sealed up, you're gonna put that label.
And you can either call FedEx.
Right here, you place the air bill here.
Or you can drop them off yourself.
So either we drop them off or we'll call them and have them come pick it up. So it's not a hard process for it. Make sure when you draw your lab, you put it in the refrigerator right away if it needs to be refrigerated. So some labs don't necessarily have to be, but your hemoglobins, the purple tops, you want to turn the light out.
Oh, show them the transplant boxes also. They do it for your transplant centers.
So here's the transplant. So we go with pen medicine. Pen medicine monthly screening kit. We open this up. There's gonna be a lab here. Inside, you got your directions. You have the labeling. And this is gonna be your box for it. Styrofoam box. See the lab tubes in there. That's gonna go right back in there. It's gonna be put into the bag. You send this box right to Penn. This is the box you're gonna use. Sorry, a little difficult to do with one hand there. And then back over here. So this is really the, you know, the simpler way of doing dialysis. It's not that challenging at home. We went over the supplies, the labs, how to make the bath, when to change out the filters, what kind of plumbing needs to be done.
I think once the patient gets over their fear, man, it's all downhill after this.
Yeah, so as far as access, have you been witnessed, and when you're in the clinic, did you see patients bleeding and stuff afterwards?
Like that's like an everyday occurrence in there.
Yeah, so you know, we know that the cleanup is supposed to be with bleach. It is a stronger concentration, just so everybody knows. We do use a stronger concentration when we're in the clinic. But there's nothing better than, you know, doing this at home.
Plus the patient's outside in the lobby waiting for that chair, and you don't know if that chair has been disinfected or not.
Right, you don't know if the door has been open. Right. See, like this chair here, this door don't open. Right, so we can never clean inside the crack here.
Right.
So if he was to bleed, or the patient was to bleed, and it went in between that crack, you're dependent on us to really put our hand down in there and clean it with the cloth. And you know, this is why you don't really want to eat when you're in the dialysis unit.
Because one speck of blood can transform into what?
Like, so if somebody had hepatitis C, one drop of blood can have millions of cells in there of the virus. It stays on the surface for 7 days. So if you're eating and you put your sandwich down on that table, right, or it's leaning on the chair. I mean, I've seen some stuff, right? Been in dialysis 20 years. This happens. We see it all the time. You know, it's a very easy way to catch, you know, something that you don't want.
And like I said, the second patient's in the lobby, and you don't know what's going on with the first patient.
So what other advice do you have there for dialysis patients, Eric,
who are in center?
That are in center, that are thinking about going home?
The one thing I can emphasize is get educated. Get educated.
Get educated. Get
your freedom back.
Yeah.
I mean, I always say, you know, people are in the center.
Right.
That I mean, you can tell they're frustrated. They all drained out. You know, I mean, get your freedom back at home.
Get the ability to do what you want to do.
Yeah, but
Don't let the illness
you know,
hold you back.
I was the lucky one. I got approached to do home dialysis, but a lot of people out there that know about it and they don't ask for it. You don't ask for it, you won't get it.
And that's normally because the routine is you dialyze in the center. You go in there 3 times a week. It's a routine. It's monotonous. Every day, you're not people aren't thinking about, hey, let me see if this patient wants to go home. Let me see if this patient's ever been talked to about home. Because you're so busy doing your own thing, trying to, get the unit running, get ready for the next patient. It's challenging. It's challenging
even after treatment
to have that time.
The patient is so wore out. I mean, they're not even thinking about home therapy. They're thinking about going home and sleeping.
Yeah. So when would you say is probably the best time to have knowledge on home dialysis?
I think the best time is when you're in the lobby, talk to the receptionist. So I'm thinking about give me some information on her home therapy. Like I said, if you don't ask for it, you won't get it.
So I agree with that, but I want to take it a step further. I think the best opportunity to know about home dialysis is when you're in the hospital. I think if we can get the message out there when they're in the hospital, because as soon as you go to the clinic, you get in that routine, you're starting to feel better. Now you're starting to have doubts like, hey, should I go home? I know what I'm getting here. They're comfortable.
Well, I'm going to emphasize on that. When you're in the hospital and you first get diagnosed and they tell you got to go through dialysis, you don't know nothing about home therapy. Nothing at all. Until you actually on the machine and you do your research, and there's other avenues you can persuade. And it's all about doing your education. I mean, when you're in the hospital and you first get diagnosed, it's like it's slap in the face.
Yeah, sure.
Everybody's numb. Everybody's thinking about, I'm dying.
Not realizing the life that you can have being in control of your treatment.
And you don't know how severe that patient is. They got all that toxic into you. You're not thinking clearly.
Clearly understand. But I think if they at least went home with some information about home dialysis,
yeah, but if they don't,
that's a good start.
If they don't provide any information about home dialysis, how's the person going to know?
They don't.
I
know before when we talked with Next Stage, that was one of our points that we were trying to push out before they were taken over by Fresenius, was we wanted to push Next Stage is if you're in the ICU, this was the machine that we used to save your life. This machine can also go home with you. So there's a familiarity of the machine equipment. It doesn't change size, shapes, and colors like the Fresenius machines would. So there's a familiarity there. And then they end up getting purchased, and that whole push kind of ended with the starting at the hospital. And now everybody's in these transitional care units, transitional care centers. Primo Healthcare Services likes to call it transitional care to home, TCH, because that's what it does. It you go to these centers, they're specifically there to evaluate if you're able to go home for dialysis or if you should be in a center. And there's many of them. They're popping up throughout the states. It's probably a better idea to go right to home versus a center. And if you can make that happen, you'd really save yourself a lot of time, a lot of anxiety. If you don't have a care partner, we can help you out.
You know, I think the doctor plays in this. When you first get diagnosed in the hospital, you know, you get a kidney doctor. I mean, he should tell you your avenues you can, information on home dialysis, what treatment you can do. Don't let them dictate you what you have to do.
Right, just limiting you to one form of dialysis. So you want to have multiple options. You know, Eric's done all of them. He's here today on hemodialysis. So he's a great patient if you wanted to talk to him. Eric, what would be the best way to get a hold of you?
My email is Gonzo here, GONZOHERE @Comcast.net. That's Gonzo here, GONZOHER @Comcast.net. And Facebook, it's Eric Gonzalez.
And how do you spell Gonzalez? I know it's a
GONZALEZ, Eric Gonzalez. I'm here to educate people.
So,
I know how the centers are.
So that's great, Eric. We appreciate that. We also want to just put in our little plug here for authority purpose. We are from Primo Healthcare Services. And if you want to find information out about us, you can go to info@primohealthcareservices.com. That's info@primohealthcareservices.com. info@primohealthcareservices.com. And my name is Tom Venuto. I'm a dialysis nurse, 28 years. Again, Tom Venuto, dialysis nurse, 28 years. You can find me on Facebook, Thomas Venuto. I'm on Instagram as well, Thomas Venuto_RN. And we can answer any of your questions. If there's a video that you would like to see, some recordings, a live stream, anything of that nature, we're willing to help out. If you want me to show you some of my tips and tricks on how to cannulate, how to put needles in, how to stick, we will gladly do that for you. If you want to learn more about the machine, we can show you how we set up the machine, how we disinfect. Later on, we're going to show you how to make the sack again. We did that last week. We're going to go over it again. Never hurts to see that done. Repetition's the key, persistence. You know, just like when you ask for dialysis at home, make sure you're persistent, consistent, and, you know, don't stop until you get what you want. So, you know, it's your right. It's your right. Get your freedom back. So, you know, this is Friday. The weekend's coming up. You know, we choose to do dialysis in the morning today. We have a birthday celebration going on. And we want to get our dialysis treatment done so that we can enjoy the rest of the day, not feel washed out, not feel beat up from an aggressive machine that you get in the dialysis center.
And I think that's a key plus right there. You don't feel drained out at all.
And you get the ability to really dictate when you want your treatments. So you're taking that control back.
I mean, suppose if I had an important stuff to do next week, you know, I contact my care partner and say, you know, if you have time, you know, let's rearrange my schedule for next week.
That's right. That's right. And, you know, it all works out all the time. We talked about a gentleman who had his dialysis in the daytime, limited his ability to work because his work didn't want him going in, working on machinery after his dialysis treatment. So he was only allowed to work 3 days a week. Once he called Primo Healthcare Services, we were able to get him home, dialyze him at night. Now he works 5 days a week, has the weekends off. Took control, took action, was able to get what he wants now, and it's a win-win for everybody.
How long has this patient been asking for home therapy? Do you know?
He was on. He was in the center for quite some time. I want to say it was at least 2 years, and you know he just didn't know about it. You know, nobody was talking about it, and we were able to have a conversation. Technician told me about him. We exchanged numbers. We had a conversation. We were like going back and forth about how this can benefit you. And as soon as we came up with the idea of let's just dialyze you at night, it was like a light bulb went off, because now we have that freedom that he was looking for. So he's not struggling anymore to make his bills. He's actually working. He's rested. It was a win-win. That one little thing just pivot. And all came because he took control of his treatment.
He took control, but at the same time, as you know, they didn't advertise home therapy in the center, so he didn't know.
No, and that's why, you know, we do live broadcasts like this to let people know. Yes, individuals are already on home hemodialysis. Yes, individuals have care partners and things like that already, but not everybody does. Not everybody's able to do that. So we want to put this out there. We want to promote kidney failure awareness, kidney exchange. We want to go ahead and get, you know, the patients educated, informed. We want them to start asking questions. I mean, the amount of money that the dialysis centers make off of private insurance, you know, makes you wonder, is there a reason why there's so many people at home and not dialyzing? I'm sorry, there's so many people at the clinic and not dialyzing at home. So, you know, we want to give them the opportunity to be informed, so they can pursue home dialysis if that's an option that they want to do.
And if you go on the internet, the web, and punch up dialysis, you know, it's going to give you a lot of research about home therapy, with treatments best for you.
Yeah, exactly. So it talks a little bit about the treatments. You know, I always think the best source is to ask the facility first. But if you're not getting the information you need, contact people who are doing this already, like yourself, Primo Healthcare Services. Go to the internet.
And
there's a lot of information on the internet about dialysis.
There are facilities out there who don't even have a home program out there.
Yeah, they don't have home dialysis because right now it's just starting to be a push because of the executive order Donald Trump had signed to get 80% of the patients home or dialyzing, or now CMS has said it's 50% that they want to see. They increased that number was so high with Donald Trump that they actually decreased it instead of increasing the resources to get that number and the amount of action needed to get that number in place. So unfortunately, they decreased the number to only 50% of the patients. But as we talked a little bit earlier, the home hemodialysis nurses are overwhelmed with the people that do want to go home. So that everybody's getting backlogged. So if you want to get on that list in your center, you should start advocating, asking questions now, getting in place. You know, I wonder too, Eric, in regards to transplants, I wonder if they're ever going to change it so that if you know you're going to kidney failure, if you can get on the list sooner instead of waiting to be on dialysis before you get that transplant.
Well, yeah, I know people who who are on the transplant list, but I think you got to be, I think probably stage 4, if I ain't mistaken.
So stage 4.
Yeah, stage 4.
And then you need to be on a list. And how long do they say the average list is?
Well, that all depends on your blood type. You know, my blood type is negative, so I get like a 6 years plus.
That's O negative.
Now, there's some people who are on the transplant list only for 2 years and then they get a transplant.
Yeah, and if you're lucky, Selena Gomez had a friend donate a kidney to her, so that was nice. You know, we talked earlier. We want to, you know, representing the Primo Healthcare Services, one of our big things is to promote kidney failure awareness and kidney exchange, and have celebrities come out and promote it, because we all know, unless yourself or loved ones on dialysis, you don't ever hear about dialysis, and you don't hear about kidney failure awareness or kidney exchange. So I recognize this, and you know, it's been my mission ever since to get you know, for Primo Healthcare Service to be a name and a face of kidney failure awareness and kidney exchange. So it's our goal to have the celebrities help promote it for us, because they are the influencers, and we know everybody listens to you when you're a celebrity, and we need them to help deliver that message. So that's part of our mission.
And a lot of people don't know about the kidney exchange program. You know?
Yeah, and how that works. So I just seen, I think there was a app that somebody was building to do something like that, if I'm not mistaken, a kidney exchange app where you can volunteer in there. So I thought that was an interesting concept, in addition to, like we talked earlier, the new artificial kidney that they're looking to implant. And
the swap is, you know, if you have a person who's willing to donate, and that person's not suitable for you, that person can swap to somebody else, and somebody else can swap to you.
Right. So that's when the network comes in, and that whole process can actually help out multiple people in that kidney exchange from all over the nation, right. Not just local in one area. It's a great concept what they do. But if you're not there yet and you're dialyzing in a center and you want to dialyze at home, you know, I'm just going to pan over here a little bit. Just, you know, I always love showing the fish tank comparison to the machine. You know, it's a great atmosphere to have, where you can be here with your family, your friends, your pets, even if they're fish.
And very relaxing.
It's relaxing, very tropical, relaxing feeling.
Instead of you having all these alarms go off.
Right, and nobody's getting sick around you. Nobody's passing out. No oxygen needed to be run and delivered to somebody. And I was showing them earlier too that when you do your saline bags, always make sure that you check for the expiration date. So this is December 31st on the bag. Also know when you're storing these that the storage has a temperature. So down here it says store in overwrap at 20 to 25 degrees Celsius, which is 68 to 77 degrees Fahrenheit. Always make sure these are stored within that temperature range. Like I said, you want to read it. Make sure you got 0.9% sodium chloride. Make sure it's not by accident something else delivered to you. Make sure there's a date. Don't just do the monkey see, monkey do routine. Know what you're doing. Make sure you are informed. You have the rationale why you do what you do. Everything should always be, why am I doing this? You should always question it. There's nothing wrong with questioning things until you have a full understanding of it. The quality of your questions will always determine the quality of your results. So,
especially when you're doing therapy at home, like I said, make sure everything is up on up. Your expiration date, your medication.
that's right. The expiration dates, medications. Always read your medications before you're giving it.
Make sure you
Get the dates on there. It's not expired.
Bag in there.
Make sure everything correlates. Don't get trapped in the routine system. Always stay alert, stay in the moment when you're dialyzing, and you should have your care partner staying in the moment with you. It's why you need the extra set of eyes to stay in that moment. So I think for today, for this time, we have about it was about 2 hours, hour and 45 minutes.
Hour and 46 minutes left.
Hour and 46 minutes left. So if anybody has any questions, or you want to come on live, just go ahead and put something in the chat. Just say yes, and I'll bring you up. You want to ask Eric or myself a question, or if there's something you don't have clarity on, if there's a way that we can help you, we want to. We want to be able to.
Did you take a picture of the cassettes in there?
The cartridges? Yeah, so I showed them the cartridges, the size of them, how much the space takes. Very small. Again, this is Tom, 28-year dialysis nurse. You can find me Instagram, Thomas Benito _RN. It's Thomas Benito _RN. And we're coming from Primo Healthcare Services. If you want information about what we do, or if you want us to work with you and your organization, we can do that as well. info@primohealthcareservices.com. It's info@primohealthcareservices.com. info@primoservices.com. And Eric can be found on Facebook. Tell us again, Eric. What is
Facebook is Eric Gonzalez. Gonzalez, GONZALEZ. Eric Gonzalez. And email is Gonzo here. GONZOHERE @Comcast.net. That's Gonzo here @Comcast.net. You know, any questions about the machine or how I feel after treatment and the responsibilities I got with the machine and the meds and how to go through all that, just let me know.
Shoot him an email.
GONZOHERE Comcast.net.
Excellent. Yeah, and again, if anybody, any questions, just reach out to us. We're more than happy to help. We're here just citing our authorities, not promoting business or anything like that. We just want to get people informed, and we want to let you know who we are, where we're coming from, and we want to be the name and face for kidney failure awareness, kidney exchange. That's Primo Healthcare Services. We're doing some remarkable things. We have an app coming out soon that everybody's going to be able to participate with. I'll let you know more as we go by. We'll come back live on here in like another hour and a half. We'll do the end of the treatment. We'll pull out the needles. I'll show you guys some tips and tricks on how to stop the bleeding. I'll also get you some footage here on we'll make a sack, and we'll end it there because we have some celebrating to do today. And we thank everybody for coming on live with us, and we'll be back shortly.
Stay great.
Let's go.